Welcome to Module 1 Section E. This content has a copyright by Teaching Adults, Inc. and may not be copied or reproduced. All rights reserved. When it comes to Certified Nursing Assistant, CNA, training, ethics and legal responsibilities are a fundamental component. Here is a breakdown of key areas covered in CNA ethics training. Core ethical principles. CNA training on ethics is often based on a code of ethics that guides nurses in their professional conduct. These principles are rooted in moral traditions and focus on patient care and professional integrity. Key ethical concepts include compassion and respect, treating every individual with dignity and respect, regardless of their background, beliefs, or demeanor. Integrity and professionalism, prioritizing patient care and upholding ethical standards in all actions. Trust and advocacy, building trust with patients and their families and advocating for their rights, health, and safety. Confidentiality, legally and ethically protecting all patient information, including medical records and personal details, in compliance with regulations like HIPAA, Health Insurance Portability and Accountability Act. Respect for boundaries, being aware of and maintaining professional boundaries to act in the patient's best interest. Truthfulness, veracity, being honest with patients and colleagues. Unethical and illegal behaviors to avoid. CNA training educates students on behaviors to avoid to maintain ethical practice and prevent legal issues. These include abuse and neglect, recognizing and preventing physical, emotional, sexual, and financial abuse, as well as neglect, which is the failure to meet a person's basic needs. Invasion of privacy, sharing a client's personal information with unauthorized individuals. Misuse of resources, using agency computers or personal phones for non-work-related activities during work hours. Accepting gifts, avoiding gifts or gratuities from clients or their family members to prevent conflicts of interest. Stealing, taking items from clients or the healthcare agency. Ignoring duties, not responding to patient needs, such as call lights, in a timely manner. Working outside of scope, performing duties that are not within the CNA's scope of practice. Resident rights. A significant part of ethical training for CNAs in long-term care settings is understanding and protecting resident rights. Residents have the right to be treated with respect and dignity, participate in activities and make decisions about their own care, be free from discrimination, restraints, abuse, and neglect, have privacy and proper living arrangements, receive proper medical care, have visitors and communicate with loved ones. Ethical decision-making. CNAs are trained to navigate ethical dilemmas by understanding their own values, to ensure their judgments are based on the patient's values, not their own. Using an ethical framework, applying a structured approach to analyze situations and make effective decisions. Informed consent. Ensuring patients are informed about their treatment, its benefits, and risks, and are capable of making a voluntary decision. Reporting unethical behavior. Knowing the proper chain of command for reporting observed unethical or illegal behaviors of other staff members.